Hey guys, how are you? So I'm just checking my setup a little bit because it took me a while to get my phone to actually focus. But anyway, happy Friday. I hope everyone is having a good day. Um, I wanted to do this vlog because I was watching the today's show news the other day and something interesting came on. If you follow me on YouTube and you have subscribed to my channel, you've heard me say before that I am a healthcare worker and I didn't re-sign up on my contract because of the burnout that I was experiencing. So basically, the Today Show was reporting on a new law. Um, they have signed something new into law for the healthcare workers to assist them if they're burnt out, if they need time off. Um, this healthcare work, I think it was a doctor during COVID, and a lot of people are still like experiencing burnout, mental health care issues, all types of issues that are just not being talked about during COVID. But anyway, there was a doctor, you guys, that was really experiencing burnout and just mentally going through stressful, just working, back to back to back. And I think the lady committed suicide. I'm gonna attach the clip of the news to the vlog I'm doing, but I found it very interesting because a lot of people haven't been talking about it a lot. You hear about it every now and then, but I can tell you for myself, as when I was working in a hospital, when I was there, you guys, the rate of mental health patients I had coming in with mental issues in a hospital was like 90%. Like I promise you, I had more patients coming in for mental health issues than COVID issues. I promise you, it was crazy. And then they had a lot of people coming in for different issues, and they would get to the hospital then test positive for COVID. So yeah, girl, it is real. It is like so real out here. So I wanted to share this with you guys because, like I said, I have experienced burnout myself, and just being stressed out and mentally and physically being stressed out by everything that's going on. And all of us have been going through it because of COVID. It's like I can't talk. Yeah. But all of us have been going through whatever we've been going through due to COVID. And it's like, what, 2 years? Yeah, I think we're at the 2 year mark because it is March. I think the first year everything was shut down was March for everybody in the United States. I can't remember what date, but I remember my kids being on spring break and they just never went back. But anyway, it's a real interesting clip. They talk about what happened to their sister. I think it's the sister and the brother or the sister and their husband, and they go on to explain everything that happened to their sister before she had this mental break and how she was working in a hospital continuously with no break and how stressed out she was. And that's why I decided to give myself a break. Right now, I'm just in the middle of trying to figure out what I want to do and what's best for me mentally, at the time, because I don't want to be in a space where I'm just working for money, but I feel so much pressure and I'm unhappy. You know what I'm saying? Like, because right now, even if everybody if everybody's going back to work or starting to get back to normal, it's still like not normal yet, guys. I don't know what it's going to take for us to get back to normal, but for me, I still don't feel like we're back to our everyday normal. Like people are still struggling and stuff. So, and I have my own struggles, of course. Like I said, I'm trying to figure out what I want to do. What's my next move? You know, because I don't want to go back to the hospital if it's not. I don't want to just have a job. I want to do something where I'm happy. I don't want to just be there for the sake of being there just to say I have a job. So I'm going to share this clip. I'm going to share this clip with you. So I hope you guys enjoy and you could give feedback if you would like. But the clip is basically them putting into law some rules and regulations for healthcare workers when they need time off, when they need break, for them to get some type of assistance and help, and to make sure that they aren't working under too much pressure and burnout. So I hope you guys enjoy this clip, and I hope you guys have a healthy Friday, and I'll talk to you later. Bye bye.
For help. Since the pandemic began, nearly half of physicians surveyed by Medscape have reported feeling burned out. Nearly 1 in 5 healthcare workers have quit their jobs.
We heard from hundreds and hundreds of healthcare workers across the country, in some cases across the world, who said to us, we have not been able to get help ourselves. We've not been able to take a break.
The Lorna Brain Protection Act easily passed both chambers of Congress, and now it's headed to President Biden's desk to be signed into law. How do you feel like this impact is going to actually be felt?
The impact is already being felt, Savannah. We are hearing from the healthcare workforce and that it is already working and helping. And the gratitude and appreciation for this right now, given what they've been through, is frankly even more important than the dollar.
What would she have thought about all of this effort and meaning you've tried to bring to a tragedy in your family?
My mom texted me right before we started talking to you, and she said, here's my 2 cents. I think Lorna is in heaven smiling down